People will frequently ask on Real Self why my Botox didn't last as long as I thought it was going to do. What I tell my patients, especially on their first treatment, is that with Botox it doesn't have a result immediately. What you're going to see is in about 3 days noticing a little bit of a weakening of those muscles that were treated. Right around 7 to 10 days is when you're going to reach your maximum effect, and Botox will last for about 3 months in most patients. There are some patients where it doesn't last quite that long. There's a few lucky ones as well who last longer than that, but on average it's right around 3 to 4 months. Now, if you did have a result and it went away much quicker than you anticipated, the most common reason is that you were underdosed. It's not that people are trying to not give you the dose that you need, but there's a range of Botox that can be injected into any given area. For example, the area between the eyes, also called the vertical ones or glabella, can receive anywhere from 20 to 50 units of Botox. The area next to the eyes, commonly called the crow's feet, can receive anywhere from 10 to 20 units, and the forehead from 10 to 20 units. If everyone received the maximum dose, then yes, you would be getting a result that would last that long, but that means about 90% of people would be paying for a lot of Botox that they never needed. So if you don't have a result lasting as long as you want it to, I would recommend that you return to your injector in order to get a higher dose at your next treatment and see if that works for you. Now, a less common reason why you're not getting the result that you wanted is you've developed antibodies to Botox. Now, this would not develop after your first treatment, so your first treatment should last as long as you would expect. Development of antibodies is much more common in patients who are receiving therapeutic Botox as opposed to cosmetic Botox because they receive a lot higher doses and a lot frequent and a much more frequent time schedule. What that happens is they develop an antibody, so the body attacks the Botox when it's injected, so it no longer works as long as you would anticipate. There are some other options if you were to develop that, but again, it is very rare for that to be the reason why you're not lasting as long as you would anticipate, unless you've been receiving Botox in very high doses at very frequent intervals for a long period of time.